I opened the door to the bright yellow house that sat at the top of the quaint street. Excitement rushed over me as I walked through the door, a little kid delighted to be able to spend the entire day with her grandparents. My grandmother was sitting at the kitchen table, so I rushed over to give her a hug. But the look on her face made me halt to a stop. Her face was curled into a grimace, while her eyes were glassed over and unfocused on anything. I began to realize that she did not know who I was. My stomach dropped, and I began to cry as I slowly backed away from her. I knew that she was beginning to forget things, but I never thought that she would forget me. Alzheimer's disease is a progressive degenerative brain disorder. According to Christina Wieringa, a research psychologist at the Veterans Affairs San Diego Healthcare System, and Mark Bondi, professor of psychiatry at UCSD, an estimated 5.3 million Americans have Alzheimer's disease. The first stages of Alzheimer's disease, or AD, consist of short-term memory loss and the inability to perform everyday tasks. This then progresses to worsened judgment, emotional outbursts, irregular sleep patterns, and behavioral changes. During the final stages of AD, individuals cannot feed themselves or go to the bathroom by themselves. There is no known cure for AD, but the effects can be reduced through physical activity, medications, and disease prevention. I will now discuss how physical activity can lessen the effects of this disease. The Alzheimer's Society of Canada has taken a different approach to treating those with Alzheimer's disease. This society funded the Minds in Motion program. The program is dedicated to improving the lives of those living with AD. Patients can be active while interacting with their peers. Minds in Motion has been quite successful in improving the lives of many of those with AD. There are many physical symptoms associated with Alzheimer's disease. Patients may experience reduced balance, muscle strength, and extreme fatigue. Regular physical activity can prevent some of these symptoms. Jessica Watson, employed in the Department of Psychology at Trent University, states, "There is strong evidence that supports the use of exercise in AD. Exercise has been demonstrated to improve cognition, quality of life, and physical function in persons living with AD. It is also important to keep in mind that mental and physical health go hand in hand. It is very easy for patients to become depressed or discouraged with their diagnosis. Exercise is a great way to improve mental health. In fact, exercise is associated with improved quality of life and decreased depression in those diagnosed with AD." Now that we have discussed how physical activity can improve the lives of AD patients, I will move on to the medications that can also relieve symptoms. Most medicines that the FDA has approved only reduce behavioral and cognitive symptoms. However, there are clinical trials to find compounds that reduce the production of the amyloid beta protein. Alzheimer's is believed to be driven by this protein. Currently, cholinesterase inhibitors are being used to treat moderate AD by preventing the deterioration of acetylcholine. This is the chemical in the brain that plays a major role in memory and cognitive ability. These drugs only work in moderate cases because as the disease progresses, the brain produces less acetylcholine. There are clinical studies that use the drug donepezil, which improves cognitive function in those with severe AD. However, high doses of this drug cause severe side effects like nausea, diarrhea, anorexia, and abdominal pain. In addition to physical activity and medication, AD can be treated through disease prevention. Studies have shown that sleep deprivation and insomnia are associated with AD and can have an impact on systems and development. Sleep is extremely important, particularly reaching the REM stage of sleep. REM sleep is crucial for learning, memory, and the growth and development of nervous tissue. A major factor in AD is the production of the amyloid beta protein, and insomnia can cause a rise in this protein. Therefore, one form of AD prevention is the curing of sleep disorders such as insomnia. Another way to practice disease prevention is by taking care of your body. Midlife obesity is a risk factor for Alzheimer's disease. Midlife obesity can cause cortical thinning. This disrupts visual memory and social stimuli. Obesity also puts individuals at a higher risk for cardiovascular disease, which is a risk factor associated with AD. Obesity is also related to a lack of exercise, and as we found out, physical activity can be essential to reducing stress and preventing the aging of the brain. Studies show that moderate to intense exercises causes greater blood flow to the brain and improved cognition. By taking care of our bodies and managing what we put into them, we can work to prevent Alzheimer's disease. I often remember the look on my grandmother's face when I was unrecognizable to her. Alzheimer's disease had completely taken her away from me. Even though I remembered all the moments that we shared, she couldn't remember any of them. I watched helplessly as AD took everything from her, including her life. Millions of Americans have similar experiences with their loved ones. According to the article, Dementia and Alzheimer's Disease, What We Know Now, it is predicted that by 2050, 14 million elderly Americans and 81 million adults worldwide will have Alzheimer's disease. Hopefully, what I have taught you today has helped raise some awareness for Alzheimer's disease and the effects that it can have.